About what to expect for the first day of therapy. For your first appointment, most people are pretty nervous. They don't really know what's going to be asked. They don't know what to share. They may be unclear about different areas of their life that they want to share or don't share. Basically, for most therapy appointments, when you come in for the first session, we call it an intake. During that time, there's a long form, somewhat formal, with some different questions that will go over your history, why you're coming to therapy now. So it may be a problem you've had in the past that you're revisiting, but what we're looking for is what's changed now. What are we looking for now? Why has it come to the point where you're in therapy now? Going to therapy doesn't necessarily mean everything's awful or wrong or not working. Often people are coming to therapy because something's just not quite as they want it to be. It might be dysfunctional, but it might not. It might be working okay. They just know it could be a little better. And they may not know the skills to get there, which is where therapists come in handy. We get trained in a lot of different coping skills and a lot of different methods and a lot of different interventions to make change happen. So we can help you make the change you want in your life to see what it could be and to be different. So in that first session, we're looking for why now? What do you want to accomplish? So we'll ask you about your goals. Research shows us that when clients are engaged in the process of discussing what the problem is and what the treatment will be, including creating the goals and objectives to reach that treatment and that change, that they get better faster. So we will be asking you questions about what your goal is and where you want to go. We might be asking you scaling questions like how bad is it now on a scale from 1 to 10, or what percentage of your day do you feel like you deal with this, so that we can have an objective measure to know whether or not you're actually making progress. From there, we're going to devise a treatment plan. Some therapists are schooled in a particular type of therapy, and that's what we call their orientation. So they may be a cognitive behavioral therapist or a solution-focused therapist. They may be a somatic therapist. Lots of therapists have lots of different training under their belt and are willing to be very eclectic with the approach. However, they may tell you that they have a particular orientation, or it may be something they advertise. You may be coming to them for something specific like EMDR, or maybe another type of trauma processing like somatic experiencing or Hakomi. Different therapies have different methods, different interventions, different terminology. So talking with a therapist before you start working with them is a good idea. Many people like to interview me before we actually meet, just to see if we're a good fit. We know that part of why therapy works is the relationship between the therapist and the client. So if your personalities don't match, it can be really hard to make that change that you want to make, to be vulnerable enough to actually look beneath what the problem is and see where your patterns lie, so that you know what to change and how to operate differently and go through the messy process, which is often really uncomfortable, of doing something new and trying something different. So in your first therapy appointment, expect to be a little bit nervous. Maybe you are, maybe you're not. Expect to have your therapist ask you a bunch of questions about what's going on now, what's changed now, and your history, including history of your family and other things like maybe education or work, things that may be playing in. What we're doing is creating a conceptual map of why you are the way you are and what might be causing the problems at the underlying level, so that we can actually shift not just the symptoms but the problem. And expect to be creating a treatment plan of some sort with your therapist. Now, sometimes they're really simple, sometimes they're more complicated. Some therapists will finish all of this in one session. Some therapists will do this over the course of a few. So questions for your interview when you first talk with them, either on the phone or in person. And that's what you can expect in your first appointment.